The doctor elevated the female patient's legs, then administered a muscle relaxant injection. Once her muscles were completely relaxed, he had her inhale anesthetic gas. In just 0.001 seconds, the woman lost consciousness. The doctor then lifted her neck, used a retractor to pry open her mouth, and finally inserted an oxygen tube. After the woman was fully unconscious, the doctor took tape and covered her eyes. The doctor wasn't preparing for major surgery, this was just a routine abortion procedure. Just as the doctor was about to begin his explanation to the students, the anesthesiologist suddenly noticed the woman's blood pressure had plummeted dramatically. Everyone nervously watched the monitors, but fortunately, her blood pressure returned to normal after a few seconds. Everyone assumed it was just a brief equipment malfunction. However, when the surgery was over, the woman didn't wake up. The anesthesiologist immediately checked her pupils and was shocked to discover they had begun dilating. The doctor immediately began examining her body, and soon announced that the woman was brain dead. What was puzzling was that the surgery had gone smoothly, and the woman had no history of genetic disorders. Why would a healthy person suddenly suffer brain death? Lisa felt devastated because the woman who died wasn't just her best friend, she was someone Lisa had personally recommended to this hospital. The hospital classified the woman's death as an allergic reaction to anesthesia, but Lisa knew this wasn't the real cause of death. She knew for certain that her friend wasn't allergic to anesthesia. She approached her husband, who was also a doctor, and told him about the situation, hoping he would join her in a private investigation, but her husband advised her to stay quiet. If they conducted an unauthorized investigation and violated hospital policy, they could very well lose their jobs. Lisa felt disappointed, but she wasn't about to give up. Soon she discovered a suspicious lab report. This report had no coding, no doctor's signature, and abortion procedures didn't even require this type of test. Lisa secretly accessed the files and discovered an even more terrifying truth. Dozens of patients had mysteriously fallen into comas over the past year. Clearly, the hospital was hiding a massive secret.